a major shift in the Trump administration's approach to the coronavirus by setting up a new group to focus on reopening the country. Now, President Trump made his first trip away from the Washington area in weeks and toured a face mask factory in Arizona. He and top company executives did not wear one, even though most of the workers there did have one on. Now the president says he's looking at winding down the coronavirus task force. That includes his top medical advisors.
Meanwhile, a whistleblower is accusing the administration of ignoring early warning signs and downplaying the virus threat. Paula Reid is at the White House for us. Paula, good morning. The president is openly acknowledging that more American lives could be lost as the country reopens economically. So timing-wise, why dissolve the task force in the near future?
Good morning, Tony. The president's announcement appeared to take some task force members by surprise. Shortly after the vice president told reporters that he was having conversations about winding down the group's work, we reached out to one of the most prominent members of that task force, Dr. Anthony Fauci. He told CBS News he had heard no such thing.
The task force has done a phenomenal job.
As he toured a mask production facility in Arizona, President Trump suggested his coronavirus task force of medical experts may be dissolved as the White House shifts its focus from saving lives to reopening the economy.
We're now looking at a little bit of a different form, and that form is safety and opening, and we'll have a different group probably set up for that.
The move to disband the task force comes as some coronavirus models predict deaths will increase in the coming weeks as areas around the country begin to reopen. But President Trump dismissed those dire predictions.
It's a report with no mitigation. Frankly, when the people report back, they're going to be social distancing and they're going to be washing their hands and they're going to be doing the things that you're supposed to do.
But the models do take mitigation into account and are based on the relaxing of social distancing that the president has been calling for. President Trump continued to praise his own response to the pandemic while trying to shift blame to President Obama.
Don't forget, the cupboard was bare. The other administration, the last administration, left us nothing.
Pressed on why he didn't do more to prepare, the president said he was busy.
Well, I'll be honest, I have a lot of things going on. We had a lot of people that refused to allow the country to be successful. They wasted a lot of time on Russia. That turned out to be a total hoax.
But one government doctor, Rick Bright, said he tried to raise alarms about the pandemic back in January and was ignored. Bright filed an extensive whistleblower complaint alleging that he told his superiors that the U.S. was woefully short on N95 masks and suggested putting together a disaster leadership group to address the pandemic. In the complaint, Bright alleges HHS official Dr. Robert Caldick suggested it was appropriate, but he was not sure if that is a time-sensitive urgency. Bright's lawyer, Deborah Katz, spoke to CBS News.
The administration was very intent on providing good news and in sugarcoating how devastating this virus was going to be.
Bright says he was moved to another department after he resisted pressure to widely promote hydroxychloroquine, an anti-malaria drug championed by President Trump. He said he was concerned that HHS actions would seriously harm or even kill members of the American public.
Bright also alleges that since 2017, he was pressured to steer government contracts to companies with ties to the Trump administration. And we've reached out to the administration for its reaction to those allegations, but so far they've only said that Dr. Bright was transferred to a role that now focuses on testing and that they're disappointed he hasn't shown up for his new job. Anthony?
Paula Reid at the White House. Thank you, Paula.